So, for substance abuse, smoking, alcohol, and illicit drugs, one of the major health issues among the community of youth in Boston is drinking alcohol and binge drinking. Because this issue and others like using illicit drugs are associated with injuries which are unintentional or fights, problems among their schools or jobs, and many behaviors that are inappropriate or illegal. Smoking cigarettes or cigars or even tobacco use is the major cause of death in the United States, which can be prevented actually throughout the United States. Around 3.6 thousand of young adolescents aged between 12 and 17 years old start smoking cigarettes, and about 1.1 thousand of them are daily smokers. Marijuana is one of the common used illegal drugs among the drugs list in the United States, and at the same time that using other illicit drugs among adolescents are decreasing. The usage rate of over-the-counter medications for non-medical reasons is still high, while the prescribed medications are also high among adolescents, and those include painkillers, stimulant materials, or sometimes to treat depression. Risk behaviors among adolescents were improving since the year of 2011, and those improvements were not only linked to sexual or mental factors, or even smoking and abusing drugs, which affects the individual's safety. Lower numbers of people are being reported as pregnant, committing suicide, hurting themselves purposely, wearing seat belts, or smoking. Some of these factors stayed the same without any change in the rates of using marijuana or the last time using alcohol or having sex. Even though the obesity rates did not change that much. Most of these risk factors for smoking, abusing drugs, or drinking alcohol starts during the time of middle school and is unlike those risk factors among high school students. Some behaviors that are being acted by high school students are playing protective roles against some other risky ones. Obvious decrease in the numbers of students who are drinking alcohol with an increase in milk daily intake, and the numbers of students discussing methods of HIV or STDs preventions with their parents or close families. There are many health consequences of abusing drugs and many other substances, and some of these risk factors, the outcomes are cancers, heart diseases, forgetfulness and dementia, hepatitis or other liver or lung disorders, infections with STIs, HIVs due to inappropriate sexual behavior, anxiety or depression, and many psychiatric disorders among pregnant females like miscarriages or among their delivered babies like congenital defects and premature death due to stroke. The risk factors for substance abuse among adolescents can be classified into different levels: individual level, peers level, family level, school level, and community level. Percentage of adolescents perceive the problem of using drugs and understanding the needs for management reach about 30% in Boston area, while the percent of drug abuse among adolescents as it was reported by Boston Public School haven't changed between 2006 and 2008. Emergency department visits and rate of hospitalization among the youth aged 14 and 18 stayed stable for many years with mild spikes up and down. The average rate of admission treatment due to drug abuse among youth that are 14 years old and older was about 40% in 2001, and it went down to 33% in 2010. and the same rates were among white youth between those 2 years. The same rates among Black and Latinos were high in 2001, between 50% and 75%, and they dropped to a similar level as Boston's average rate in 2010. The rate among Asians was about to be zero between those 2 years, and it was stable also. The mortality rates among adolescents who are abusing drugs and other substances reached its maximum between 2005 and 2007, but the but it went down in 2008. Mortality rate among adolescents who are drinking alcohol reached 21.3% in 2008 in Boston, and the homelessness rates among substance abuse adolescents increased from 30% in 2001 to 42% in 2010. The rates of substance abuse differs among different races, ages, being males or females, education level, and socio-economic status of the community members. Most substance abusers were reported among American Indians, Native Alaskan, and African American people. About 7 million adults aged between 18 and 25 years, and about 12 million of older adults, 26 years or older, were reported as drug abusers in 2008. There are many programs that are licensed and funded to treat and deal with this issue of substance abuse among youth in Massachusetts, and some of them are the Massachusetts Department of Public Health, Bureau of Substance Abuse Services, and the other one is the Office of Youth and Young Adult Services. Thank you very much, and here are some of the references of the previously mentioned points. Thank you, and have a good day.